Hello, this is Dr. Ken Anderson at the Anderson Center for Hair with a special guest, Jason. Jason, how you doing?
Great.
Jason is a patient of mine who has graciously agreed to be on camera and tell you folks about his experiences with us. So we met in consultation recently. We went over Jason's desires and needs. He needed a little help in the frontal hairline. What we did yesterday, this is just a little under 24 hours since we finished the procedure. We did an FUE extraction of pushing 1,500 follicles from the back and sides of his head, or the donor area. These were then densely packed into the recipient area, which is the frontal hairline area, as you can see through here. And in the back, in the crown area where he had a little bit of thinning, we used 5 cc's of exosomes along with some microneedling to attempt to thicken up that hair. Anyway, that's what Jason's been through. So tell us a bit about your day yesterday. How did it differ from maybe your expectations? Was it painful? What stood out to you? What information do you think the people at home would be interested to hear about?
I feel like the staff kept me extremely comfortable throughout the procedure. There were a few times where I woke up and was aware of what was going on. If there was any pain, it was very minor, and I promptly let the doctors know about it, and they quickly took it away. And most of the time, I just slept.
Yeah, that's pretty typical. Patients typically sleep through most of the procedure. How did your hair loss bother you before you reached out to me for a consultation about it?
My hair loss was bothersome in the fact that I was slowly starting to notice how thin it was getting. It wasn't really the recession. I could see the recession mildly in the front because I had a suntan line from a lifelong or a lifetime of being out in the sun, and it had gone at least a half inch past that. But really in the front, as I started to have one hair in the front of my forehead, and then half inch back is where the rest of my hairline was, I was really starting to notice how much I was losing.
Okay. Well, and what made you decide to do something about it?
You and I met 10 years ago, and during that time, I was not a candidate to be a patient, but I learned a lot about what you did, and when it came time for me to do it, um, I came across the money, and I was ready to make the choice to look more handsome.
Well, very good. And that a lot of I find you're not alone in doing that. A lot of patients, get worried about their hair loss and wait a little bit of time, sometimes 10 years, to actually do something about it. But my philosophy in treating hair loss is that really one wants to be proactive about it. The earlier you can address hair loss with prevention measures, the better, because that's going to dramatically slow down, appear to stop the hair loss in most cases. In some cases, it can reverse the hair loss, so you can avoid a hair transplant altogether, and you can push that off for, in some cases, decades. We offer both the FUE and the FUT. I think neither is a panacea. An FUT is great for some patients, and FUE is great for others. And so why did you choose the FUE procedure? I know you wear your hair quite short. Was that one of the main determinants?
It was, but the FUE procedure, I do wear my hair in at a 1 or 2 guard, and so the FUE was the choice for sure.
That's great. Yeah, FUE is a type of one of the ways to do hair transplant surgery. It's something that I've personally been doing since 2003. So I have a lot of experience with the technique. And the instrument we use is the WA Duo system out of Belgium. Their punch design is ingenious, and we use the 0.9 millimeter punch on you. So very tiny donor area wounds that you can barely see in photographs. And actually, right now, just go ahead and look over towards the wall. It almost just looks a little bit red. Okay, certainly not bloody. And this, we're less than 24 hours from the procedure, so you can sit around. So within about a week to 10 days, enough hair will grow out around those tiny little wounds, and it becomes imperceptible. Any final thoughts you'd want to give the prospective patients out there who are maybe considering having a transplant?
I would have to say, after doing all of my research and experiencing the concierge service of Dr. Anderson and Anderson Center for Hair, is that if you're going to do it, you got to do it here.
Well, that's nice of you to say. We've been doing hair transplant a long time, and I've thought not only about the results, which I want to be natural and permanent, but about the patient experience. What is it like through the initial consultation, through the procedure? We serve a catered lunch, for instance. It's the little things, that make a big difference. And I'm glad you had a good day. So we'll be talking. I know I always call the patients the next day. Sometimes they come in for a hair wash. But I will be in touch with you in the coming weeks. We'll give you a checkup call at 3 months, 6 months, and 9 months, and then a year. I want to see you back in a year. In the meantime, as with most all of my patients, I want you to do the things we talked about to prevent future hair loss: the laser cap, the topical medication. I would get some PRPs in the next year, according to the instructions I gave you. And great to see you. Thanks very much for sitting down with us today.
Absolutely.
This is Dr. Ken Anderson at the Anderson Center for Hair, and you've been watching a patient interview with Jason.